Are children affected with COVID-19 and how severe is it? Yes, children are affected with COVID-19. Most of the children have a mild infection and a very few children move on to having the severe infection. And also the rate of recovery is much higher as compared to the adult population in children. It is hypothesized that the receptors to which the virus attaches itself causing infection, the receptors in the lung, are not very well developed in children, which could be the reason for the milder infection in children, the higher rate of recovery, as well as a very small number of children go on to having the severe acute respiratory illness. And also it was seen in the population of children studied on with COVID-19 that most of them who were affected had an underlying congenital disease or an acquired disease previously diagnosed. So these children with previously acquired disease or a congenital disease were more susceptible to getting the COVID-19 infection. And one more thing to note here is most of the children affected with COVID-19 had an underlying co-infection. So, and this is evidenced by the laboratory tests. The procalcitonin levels were high, which is a marker for bacterial infection, and thus it is recommended that children with COVID-19 to be started on antibiotics to prevent the co-infection or treat the present underlying co-infection in the child. And most of the data which we have is from December of 2019 up till now. So among the data which we have right now is from where we are drawing all these conclusions based on the CDC as well as the WHO and the ICMR, and obviously more data is required to come to exact figures and numbers about recovery rate, about fatality rate, as well as rates of severe infection. But as of now, the results in children have shown, whatever results we have from the pediatric data is not really worrisome. What precautions should we take to prevent children from COVID-19? The same precautions what is advocated for adults can be followed by children too. That is regular washing of your hands with soap and water or using an alcohol-based hand rub to wash away the virus from your hands. To avoid touching your face, that is your eyes, nose and mouth, which are entry portals for this virus. And also to maintain a 1 meter distance from people who have cough or cold or any signs of respiratory illness, and to follow respiratory hygiene, which is not coughing or sneezing into the air, but using your sides of the elbow to cough or sneeze, or using a handkerchief to cough or sneeze. And if the child has any signs of respiratory illness like a running nose, cough, to stay at home, to take care of themselves at home, to self-isolate, and so that it prevents the spread of these droplets into the surrounding. How susceptible is a pregnant woman to COVID-19? Yes, pregnant women are susceptible to COVID-19, and how susceptible in comparison with the general population? They are equally susceptible to the COVID-19 and not more susceptible as thought otherwise when you compare them to other viruses like the influenza virus, rhinovirus. Here the susceptibility is same like the general population, and this has been found by looking at the large number of data around the world in several studies, the links of which, if you would want, I would provide them in the description box or in the comments below. The pregnant women who are living in the containment areas, in the hotspots, cluster areas or the migration gatherings are more susceptible to the COVID-19 infection, and as recommended by the ICMR have been asked to test even when asymptomatic in the hospital where they plan to deliver. Can a pregnant woman with COVID-19 transmit the virus to the fetus? So the answer to this is no, or very unlikely from the data which we have. Mother to child transmission, what we have information from the data which we have is very unlikely. The amniotic fluid, the breast milk and maternal samples from COVID-19 positive mothers have all been tested negative for COVID-19 so far. However, after the birth of the baby in the newborn period, the newborn is susceptible to infection from person to person spread. There are very few newborns around the world who were found to be positive with COVID-19, but we do not know if this was in utero or after the birth from person to person spread. Can we use masks and how safe are they? Yes, you can use masks. WHO recommends the usage of masks, surgical masks, by COVID-19 positive patients as well as people taking care of the COVID-19 patients or around COVID-19 positive patients. This is to prevent the transmission of droplets into the environment and thereby to other people infecting them. And in view of the shortage of masks worldwide, WHO has urges the public to use these masks rationally and also to see that it is not wasted by unnecessary usage. However, CDC, that is the Center of Disease Control and Prevention, has come up with other ways of tackling this problem. They have given measures of making cloth masks at home. If you want to see how you can make these masks with simple cloth at home, you can go to the CDC website, and these are cloth coverings which can cover the nose and the mouth, as well as you can also wear cloth bandanas which cover your nose and the mouth, which will prevent the droplets from entering into the environment, thereby causing infection, and also prevent the droplets from entering into your nose. So these simple measures can be done as a voluntary public service measure, and these masks are not recommended for children below the age of 2 years because it can cause suffocation and they wouldn't be able to open it by themselves. I hope I've addressed most of the commonly asked questions, and if you have more questions, you can reach me here and I will get back to you. Bye-bye.